Hello guys, welcome back to my channel. So today I will be covering the renal system, which is basically the renal function and stressors. Now before I get started, there's a disclaimer. I am a tutor, not a teacher. Whatever you learn from your professors, just use this as to kind of build on what you have already learned. I am not here to replace your professors by any means. Make sure you subscribe to my channel. You know, I will be uploading as often as possible, maybe twice daily, depending on how much material I can cover per day. So make sure you subscribe in order to get notifications that I uploaded a video for you guys' upcoming exam. So let's get straight into it. The renal system is comprised of the upper and the lower urinary tract. So the upper tract is consisted of the kidneys, which we know we have two, and the urethra, which is a tube connecting from the kidney to the bladder. Now the lower tract, you have your urethra and your prostate for the males. Now for the kidneys are two pea-shaped organs located more posteriorly against the back muscles in the upper abdominal cavity. So the right kidney can be palpable or may be palpable, but the left one is not so palpable because it sits 1 centimeter above the right. So what are some functions of the kidney? So the kidney helps to regulate blood pressure, fluid and electrolyte balance, maintains acid-base balance, ultrafiltration/reabsorption, excretion of metabolic waste, erythropoiesis, which is the production of red blood cell. It also can regulate calcium and phosphate metabolism, and micturition, which is simply peeing. So the kidney plays a very vital role in our body. We cannot live without our kidney, and if we lose our kidney, then we have to do like a hemodialysis or a peritoneal dialysis. We will talk about that later in the video or in part 2. So let's move to urinary tract infection, UTI. So this is an infection of the urinary system. Can it occur anywhere along the urinary tract? Yes. So we can start from the bladder, it can move its way up to the urethra, and then it can go into the kidney. Alright? So the terms that you need to know for the different infections of the urinary tract. So an infection in the bladder is called cystitis, while an infection of the kidneys are called pyelonephritis. So there's two completely different terms. Make sure you remember those. Once you develop a UTI, make sure you get it treated as soon as possible, because if not, it can cause permanent damage to the kidney. So some signs and symptoms you can look out for when you have a kidney infection: dysuria, which is painful urination, blood or white blood cell in the urine, which you would have to do either blood work, a urine panel, or a urine test. Cloudy urine, possible fever. So the treatment for UTIs are antibiotics. So antibiotics are the main treatment for UTI. So there are some measures that you can take to help prevent UTI or the reoccurrence of a UTI. Voiding frequently and after sex. Wipe from front to back for the females. Avoid baths. You don't want to submerge your peritoneal area in water for a long period of time because that increases the risk of developing an infection. Do not douche. So basically douching will change the pH of the vaginal canal, and this can introduce or enhance the growth of bacteria. And douching also removes the normal flora from the vaginal canal. And the last preventative method is do not use perfumes. So let's move on to acute renal failure. So there are 3 types. You have pre-renal, intrarenal, and post-renal. So let's begin with pre-renal. When you think about pre-renal, think about before the kidney, or something that is going towards the kidney. So causes of some pre-renal conditions include a decrease in cardiac output. That means the kidney is not getting enough blood, or there's not enough blood being perfused to the kidney. A shock. Whenever you have a shock, you have vasodilation, decreased blood pressure. So if you have a decrease in blood pressure, you know that the kidney is not going to get enough blood supply. Congestive heart failure, failure for the heart to supply blood around the body. Also, failure for the heart to supply blood to the kidney. Pulmonary embolism, sepsis, anaphylaxis. So think about things that can affect the kidney, or think about situations that are going towards the kidney. Alright, so for your intrarenal condition, this is caused by kidney tissue damage or renal tissue damage. Alright, so basically you have your pyelonephritis, which is your UTI. If it is left untreated, then you will have a permanent damage that will lead to an intrarenal condition. You have glomerulonephritis, vasculitis, acute tubular necrosis. These are some things that can cause intrarenal conditions. So intrarenal, something is going on inside the kidney. Alright, so let's move to the postrenal. Postrenal is caused from an obstruction or a blockage of some sort, going away or moving away from the kidney. So if you have a calculi, if you have a tumor, if you have atony of the bladder, if you have urethral stricture, so anything that will cause you to retain any urine or decrease the flow of urine outside of the body, then that can lead to a post-renal condition. Right, so whenever you have an acute renal failure, there are 4 phases. You have your onset, your oliguric, your diuretic, and your recovery phase. So, in the onset phase, gradual accumulation of nitrogenous waste. That means you're going to have an elevated BUN, you're going to have an elevated creatinine. Please refer to your book for the lab values for your BUN and creatinine. I really don't want to tell you a value and then it's something different in your book, because numbers do vary from text to text. So make sure you check on the BUN and creatinine normal lab values. Alright? In your oliguric phase, urinary output is decreased. So oliguria means decreased urinary output. So the oliguric phase, that means there is a decrease in production of urine or a decrease in urine output. Alright, so in this phase you will have increased BUN, you will have hyperkalemia because you're not eliminating this waste. You will have metabolic acidosis, hypocalcemia, hypermagnesemia. Now keep in mind that calcium and magnesium are inversely related. So if you have a high calcium, you have a low magnesium. If you have high magnesium, you're going to have a low calcium. Alright, so and hyperphosphatemia. So again, in the oliguric phase, you'll have hyperkalemia, metabolic acidosis, hypocalcemia, hypermagnesemia, hyperphosphatemia. We know that if you are not excreting urine, you can have a buildup of toxins. This buildup of toxin can cause a depressed in the immune response. Alright, the diuretic phase, high output phase. Up to 10 liters of urine is produced daily. This does not mean that the kidney is back to functional normality. This does not mean you're getting rid of the waste adequately. You're just diuresed and the kidney is trying to repair itself, so it goes into this diuretic phase. And then the final phase, which is the recovery phase, begins when the BUN is stabilized to normal. Client begin to return to normal activities. So again, all 3 phases, you have your onset, you have your oliguric, you have your diuretic, and you have your recovery phase. Keep these in mind. Okay, so there's one phase we need to talk about in addition. So the oliguric phase, you know that you are retaining fluid in this phase. So what are some things you need to keep in mind? Make sure you watch your intake of fluid, because you can easily go into fluid volume excess. Watch out for high risk injury. If you have too much fluid in the body, then this can lead to tissue breakdown. And with all illnesses, you got to make sure you maintain an adequate nutrition. Some assessments that you may notice in a pre-renal condition: so hypotension, tachycardia, decreased cardiac output, and CVP, decreased urine output, and lethargy. So intrarenal and postrenal, you can either have oliguria or anuria. Oliguria, decreased urine output, anuria, no urine output. Also, in the intrarenal and postrenal phase, you may have hypertension. Why? You are retaining fluid. Retention of fluid can increase your blood pressure. Tachycardia, the heart is trying to pump out as much fluid as possible. You may experience jugular vein distension and an increase in central venous pressure. So in acute renal failure, you may develop respiratory symptoms. These include shortness of breath Orthopnea, meaning you have difficulty breathing when laying down. Remember, difficulty breathing when laying down. You may hear fine or coarse crackles depending on how much fluid is in the lungs, and pulmonary edema. So these are some issues that you really need to address. You may also develop GI issues such as anorexia, nausea, vomiting, flank pain. Whenever you have flank pain, more than likely you have pyelonephritis. So if you have flank pain, you might have pyelonephritis. What is pyelonephritis? Kidney infection, right? So if you have this buildup of all this fluid and all this waste in the body, then it might cause neuro problems. So what are some common neuro problems? Confusion, lethargy, tremors, headache. So the homeostasis of the neurosystem is thrown off basically. You have too much toxins in the body, so it might manifest itself in neurological problems. So now we're moving on to chronic renal failure. So chronic renal failure can be a stem from acute renal failure or a prolonged acute renal failure. Right? Acute renal failure is over a short time. Chronic renal failure is over a long time. So let's go through the stages. So there are 3 stages. Stage 1, diminish renal reserve. So what that means is that the kidney is unable to increase its glomerular filtration rate, which means it's trying its best, it's trying to get rid of the toxins, but it won't increase its filtration rate. So if it's not increasing the filtration rate, you have an increase in fluid or a retention of fluid in the body. This can lead to, again, increased blood pressure, decreased ability to concentrate urine, nocturia, and polyuria. So you can experience both. At one point, the kidney might say, all right, I'm getting the hang of it. I'm trying to get rid of this waste. And then the kidney is so exhausted now that the kidney is so exhausted that you go into the oliguric phase. So stage 2, renal insufficiency. Renal insufficiency means basically the kidney is unable to excrete this waste. Inability to excrete waste means waste buildup in the body, and it can lead to what kind of problem again? It can lead to cardiac problem, GI problems, and neuro problems. Alright, so stage 3, which is end stage renal failure, now it's like you cannot even come back from this. Excessive amount of urea and creatinine in the blood. Alright, so make sure you remember this, guys. If there's too much urea in the blood, you can develop what is called a uremic frost. Uremic frost is basically the body's trying to get rid of this excess urea that is built up in the blood. So it will start manifest itself on the skin. So you might have itching, you might have dry skin. So basically, skin hygiene is most important when you are in this phase, because this urea on the skin will cause a breakdown of skin tissue. So for a person who has chronic renal failure, the only treatment is either hemodialysis or peritoneal dialysis, and we will get into that further. Alright, so the early phases of chronic renal failure. So for sodium, you might have hyponatremia. Why? Because remember, the kidney is trying to repair itself, it's trying to do its job. So you might have hyponatremia because you're peeing excess or you're having polyuria. Now, later on, or in the later stages of chronic renal failure, you still may have the hyponatremia, but at this point, you are not peeing. So you might develop oliguria or anuria. Basically, you will get what is called dilutional hyponatremia. Think about it. You have 1 gram of salt in 10 grams of water. If you add 20 grams of water to that same 1 gram of salt, it's going to be diluted, correct? So that's why we call it dilutional hyponatremia. Right, so where potassium is concerned, you might develop hyperkalemia. So the range for hyperkalemia is usually 3.5 to 5.0. Remember, refer back to your book to get the number that is being taught to you guys. Alright, so whenever you have hyperkalemia, it is a big issue. You have to make sure you pay attention to cardiac function, because it may cause fatal dysrhythmias. You might have acid-base imbalance because you're not eliminating out all this metabolic waste. So there is going to be a buildup. You might have an acid-base imbalance. You have calcium and phosphate demineralization, and uremic pruritus. Remember I mentioned earlier you can develop uremic frost. This may cause itching, pruritus, itching, uremic pruritus. Alright, so when you have chronic renal failure, you may have cardiac alterations, hypertension, congestive heart failure, and left ventricular hypertrophy, because the heart is working overtime to pump this excess fluid around the body. Uremic pericarditis, hematologic alterations, and GI alteration. Alright, thank you guys for watching this video. In the next video, I will be talking about hemodialysis and peritoneal dialysis. Remember to subscribe to my channel so that you can stay updated with the latest information.